All right, what's up? Welcome back to the Fit 40 podcast, where we simplify exercise and nutrition for busy parents 40 plus so they can improve their health and feel amazing. Today, we have an awesome guest with us. We have Dr. Gabby Gerbino back for another awesome episode. You might remember her from the 2 GLP-1 episodes we did back a while ago. Today, we're going to be talking all things high blood pressure and how to bring it down. So, Dr. Gabby, welcome to the show.
Awesome. Thanks for having me back. It's a very, very different conversation than our last time, but just as important, something I deal with a lot in our internal medicine practice.
Yeah, absolutely. And they're kind of a little bit interrelated because, I mean, we could assume that a lot of people that do explore GLP-1 medications probably do have issues with high blood pressure as well. Not across the board, but I mean, usually when people are sick or they're not healthy, it's not just one thing.
Right, exactly. And a lot of the things I think we talked some about it with the GLPs, but everything like metabolic syndrome, it all goes together. High blood pressure, high cholesterol, diabetes, all of these things are like looped in together.
Exactly. So let's dive in on the fun one, which is high blood pressure, because I know we were talking about the stats beforehand. We're like, so what are they again? So I had to do a quick Google. I knew it was about half, but roughly 48% of Americans have high blood pressure, which is kind of scary considering all the downsides that come with having high blood pressure, because now it just seems like it's almost a norm. But for anybody who doesn't know, like, what are some downsides from having consistently elevated blood pressure?
So having high blood pressure can do so many things. Very common that we see a lot in the hospital, stroke being one of the top things. We'll have patients that come into the hospital with extremely high blood pressure and they've had a stroke, heart attack, anything that's causing anything with the heart. You can have hypertensive cardiac disease, which causes stress on the heart. You can even have damage to your eye. There's hypertensive eye diseases that affect the retina, affect the way you see. There affects all of your blood vessels in your body basically when you have high blood pressure, so it can cause a lot of complications. It's something that I see very commonly in the office, and it's actually something that's been highly studied as far as treatments and guidelines, and there's been like a lot of variation on guidelines, but the better, stricter blood pressure control is seen to have less morbidity and mortality, like less of those like complications.
Yeah. And it's interesting you bring up the eyes because I know Amanda, my fiance, who Gabby did her residency with, how we know each other. She was having some eye stuff going on, and she's like, it could potentially be from like high blood pressure when on birth control. And I'm like, really? And she's like, yeah, like that could be a real thing.
Exactly. Yeah. My background actually was in ophthalmology. I worked in ophthalmology for about 10 years before I went to medical school. And we saw this multiple times. And I've seen the doctors that I've worked with, the ophthalmologists, diagnose high blood pressure by simply doing a dilated eye exam, because you don't check blood pressure normally in like an eye doctor's office. Like you would just bring the patient back, you check their eyes. But then when they look at their retina and they see certain things and they're like, oh, wait, you probably have high blood pressure. And then they check their blood pressure and it's elevated.
Yep, it's crazy. And I know another one that threw me off when I was talking to Amanda about it is like how it could affect your kidney function. I'm like,
Yep.
really? So she's like, pretty much any organ is up for grabs at that point.
Correct. Because your blood pressure is basically like you have to pump blood to every part of your body, right? So any fluctuation in your blood pressure can cause blood supply to be decreased to different organs in the body. If you have a drop in your blood pressure, that causes damage to your organs. So blood pressure is super important to what we call like our homeostasis, like keeping our body at a normal, everyday kind of what it should be, so to speak.
Yeah. Yeah, it's just wild when it comes to all that. So when now everybody's listening and they're like, okay, you had my curiosity, now you have my attention because I don't want this to happen to me. Like, what are the levels? Like, what should somebody aim for as far as like a good day-to-day level? And what are some where it's like, okay, probably worth like either paying attention to or even going to their doctor to manage?
Right. So there's, like we talked about before we started, so there's schools of thought. Something that basically I go by is the ACC AHA. So the ACC is the American College of Cardiology, the AHA is the American Heart Association. They're on the same page as far as what are guidelines, what I go by. So when I see a patient in the office, I look for a blood pressure less than 130/80. That's my goal. Any patient that has a blood pressure greater than 130/80, that's the definition and the diagnosis of hypertension. There are these stages as well. So like stage 1 would be 130/80, and then stage 2 is anything above 140/90. The stages to me don't make much of a difference because I'm still treating the patient the same. It just depends on how high their blood pressure. There's also, you could have hypertensive urgency and emergency. That's a whole different conversation, which we probably won't get into. But just for me, when I see a patient in the office, if their blood pressure is 130/80, I'm saying, okay, we need to take a look at this and see if there's anything else going on. As far as diagnosing somebody with hypertension, the guidelines recommend that we have 2 blood pressure readings at 2 separate visits. I also like patients to check their blood pressure at home as well. So do like an ambulatory, they call it ambulatory blood pressure monitoring, and with a home blood pressure machine. I recommend to my patients, there's a website called validatebp.org. On there, it will give you, this is the list of the good blood pressure cuffs and the ones that are the best.
And that'll be in the description or the show notes wherever you guys are watching or listening, because I want to make sure you don't have to go searching for it and get the wrong
Don't
one.
search for
So
it. Yeah, exactly.
go down and
Exactly.
click.
Exactly. So yeah, so 130/80 is our kind of cutoff, and that's when I start kind of going from there as far as, okay, what are our next steps? What do I need to tell my patient, and what do we need to do going forward?
Gotcha. And when it comes to home monitoring, that was my next question, because that's starting to pick up some steam in the fitness and wellness space, is people monitoring themselves day to day. Because I mean, as we know, with like continuous glucose monitors, unless you're pre or full blown diabetic, doesn't make a whole lot of sense. But there's grifters left and right trying to scare people about normal insulin responses and blood sugar spikes, but
Right.
we won't get into that. But my mind goes to, okay, is this under that same umbrella of bullshit, or is this like actually valuable? Is there some merit to monitoring your blood pressure, even if you're healthy, just to make
Mhm.
sure it's not rising?
Right. So I don't know, as far as like monitoring, I've never recommended a patient to just monitor their blood pressure at home no matter what. But I'll give my spiel that I give to my patients if they do have high blood pressure. So say you're a patient coming to my office, this is our first visit. I check your blood pressure in the office, it's 130/80. I go, okay, talk to you. I say like, hey, your blood pressure is a little bit high here in the office. What I want you to do is I want you to go to the website, find a blood pressure cuff that you can have at home. I want you to get up in the morning, go to the bathroom, empty your bladder. I want you to sit on the side of your bed, relax for a little bit, maybe if whatever your normal routine, if you go into the kitchen and sit down and take your blood pressure. This is before you've taken any medicine, supplements, you've had coffee, anything like that. I
So
want you to
no,
take your
no
blood pressure. Yeah,
Celsius.
no
The
Celsius.
the unofficial sponsor. They don't know they are, but they are of this podcast.
Be like, if you want to sponsor me, give me a
Just
call.
throwing it out there.
Just throwing it out there. Yeah, no Celsius, no coffee, nothing with like caffeine, obviously, which can elevate your blood pressure. So I want you to check your blood pressure, and I want you to wait 5 minutes and then check it again. That gives us a nice little average. Then I usually tell patients at the end of the day, at the end of the night before you go to bed, again, when you're like sitting, relaxing, take it again, so we can kind of have a log and we have a monitor of what your blood pressures are. If you come back to me and you show me your blood pressure log and you're pretty consistent at like the 130s/80s, you're still pretty consistently 130s/80s in my office, then that's when we'll discuss starting a medication. But there is merit and there's data behind doing blood pressure at home, because there's this also concept of like white coat hypertension, which is an actual thing. And there's also something called masked hypertension, which is where a patient has normal blood pressure in your office, but high blood pressure at home. But there's nothing, I would never recommend for like a young, healthy person to check their blood pressure regularly. There's no merit behind it unless they're having symptoms like headache is a very, very common symptoms that patients will get with high blood pressure. But for a young, healthy person, and unfortunately, a lot of the data that we have on blood pressure and the risk factors and all the complications, everything's been studied on patients over the age of 40. So don't have a lot of data on like young, healthy patients. But I wouldn't generally recommend it for just anybody, no matter what, to just take your blood pressure normally, because that also can induce high blood pressure. It makes you anxious. You're like, oh, wait, why is my blood pressure high? And you could be having an off day, or we'll probably talk
You
about this,
could
but
have
if you
a what
eat
they
too much
call like a
salt, yeah,
nocebo, like a
yeah,
nocebo, where it's like you're in this place where it's like you're expecting something to happen, so it does happen, even though
right,
nothing caused it other than
right,
you.
right, right. So there's no merit behind that. It's just all of our data is behind. If you do have high blood pressure, I see something in the office, this is what I want you to do at home.
Yeah. And for those that are in that category of like they're under that 40-year mark and they're somewhat concerned, maybe they went to their doctor and it's a little bit elevated. When it comes to the whole, because I know there's a stigma, at least in the fitness and wellness space, that like doctors just want to put you on medication. But there are a lot of lifestyle factors that can be at play that can be managed before going down that road, right?
Absolutely. Yeah. And that's always so if you ask anybody, if you are talking about like our exams and the board exam, the first thing you want to do is diet and lifestyle modification, especially for a young, healthy person who otherwise only doesn't have anything else going on. So it's very common you'll hear the salt intake, your sodium intake. How much salt are you putting on your food? And if you're not putting salt on your food, or if I have a patient that's like, I don't put any salt on my food. So I ask them like, well, what do you eat on a day-to-day basis? And they're like, well, I don't really like to cook, so I eat frozen meals. There's a lot of sodium in those frozen meals. Or if you go and you check like the chicken broth, there's a lot of sodium in the chicken broth and those sort of things. There's also been a lot of data behind exercise, which I'm sure you can speak to as well, increasing your cardiovascular like heart rate and your extra, you go on a treadmill. I don't, not my area of expertise, so that's you could speak more to that, but there's a lot of data behind that. And doing exercise, like I try to recommend to my patients, at least going for a walk a couple times a week, getting your heart rate up somehow. But as far as diet goes, it's the biggest thing is decreasing your like sodium salt intake.
Yep. Yep. And
Fruit.
I actually had like a list here because I know that there's like a number of different factors. And I know another big one on there too was alcohol, which a lot of people really like struggle to get out of their lifestyle, whether it's due
Mhm.
to helping with stress, whether it's just an ingrained habit, like it's
Yeah.
just part of their life. How big of an impact does that have?
So it actually does have quite a big impact. And I actually have some patients where they had high blood pressure and they were not like a heavy drinker, but they did drink a decent amount on maybe the weekends or things like that. And then they stopped drinking and it helped improve their blood pressure. So there definitely is some data behind cutting your alcohol intake and that helping to lower your blood pressure.
Yeah, because I noticed like I've been doing an experiment on myself because I totally meant to lead with this, but I or my fiance bought one of those blood pressure cuffs from Walgreens and we strapped it around and it showed that I was elevated. So I've been on like this kick trying to like figure out what the deal is with blood pressure. And this morning I went to go take it and I'm like, this seems off. I was at like 140 systolic, which is that number up top. And then I was at 70 diastolic, which is that number at the bottom. And I'm like, huh, I had 2 drinks last night. Would that have any impact? And she's like, yeah.
Hmm. Yeah, definitely a possibility for sure.
Yeah.
And I
Yeah.
think
And
a lot
that's,
of it comes from like alcohol can dehydrate you. And when you're dehydrated, that can increase your blood pressure or decrease your blood pressure. It can do multiple things. But I think I'm not exactly sure like the research or like the science behind it, but I know that alcohol can cause fluctuations in your blood pressure.
yeah. And that's also a good case for getting your water in, right? Because if you're
Yes.
dehydrated, that's going to play a big role as well.
Yes. Yes.
And also another thing I wanted to touch on too is if anybody is doing the home monitoring, make sure you get your cuff size right. Now,
Yes.
I know this won't be a problem for many people, but if there are people like myself that actively try and increase their bicep and tricep size, you might need the bigger cuff because when you get a cuff that's too small, it will show higher blood pressure than if you get the appropriate cuff. So measure the circumference of your upper arm and then go with that cuff that matches.
Exactly. Yeah, the cuff size does matter. That's why they make different cuff sizes. There's even cuff sizes for like babies because the blood pressure cuff size does matter and will make a difference and cause fluctuations as well.
Yeah. I still remember I went to the doctor, what, a few years back, and they took my blood pressure and the cuff popped and exploded. And I'm like, sorry. And he's like, honestly, it happens like 3, 4 times a day. I'm like, well, you
Yep.
just took a great moment and ruined it. Could have bragged to everybody, but no. But anyway, I digress. So I'd love to go down that like lifestyle like path and talk about some things that people can do because I know, I mean, whether for better or worse, many people are a little bit medication averse. And it's like,
Hmm.
if you don't want to go down that path and you are in control of these factors and they do bring you to a healthy level, why not?
Right.
So, first one I have on the list is body weight. That's a big one, right?
Hmm. Yeah, absolutely.
And how, like, for anybody who's interested in like the physiology aspect of it, like, what does the extra body weight do that naturally increases our blood pressure?
So that's a great question, and I'm honestly not an expert on it. I think
And
that when you
everybody
have,
listening right now, when somebody says, I'm not an expert or I'm not that familiar, that's how you know somebody stays in their lane and doesn't try and say too much. That's
yeah,
like a sign of a true expert. So just something to look out for. Sorry
yeah, I
to
definitely
cut you
stay in
off.
my lane. No, you're fine. I definitely stay in my lane. I'm internal medicine. A lot of the times when it comes to blood pressure, this is very like a cardiologist or a nephrologist or a kidney doctor, like their area of expertise. But um, anytime that we talk about like metabolic syndrome, so like your body mass index can cause high blood pressure, high cholesterol, diabetes, all of these things. You're putting extra stress on your body. You're causing your body to have to work a lot harder to pump to those organs. And when you are overweight, unfortunately, and you have higher body fat, that can also cause arteries to become clogged. You're at higher risk for like coronary artery disease, which coronary artery disease drives hypertension. So when you have like those blockages in your heart, in your vessels, that can cause high blood pressure. So um, higher BMI, it just kind of like goes together, unfortunately.
I mean, it's just bigger people, their hearts need to work harder, like plain and
Exactly.
simple.
Exactly.
Yeah.
100%.
And that actually brings me to my next factor, which was diet, because I know we touched on sodium, which is obviously huge because that plays a role in blood volume, correct?
Yes.
And for anybody like if they were a patient that you were explaining this to, how would you explain like the sodium impact when it comes to high blood pressure?
So it has to do a lot with like the kidneys and the way that the kidneys reabsorb, and there's this like renin, angiotensin. This is a lot of like physiological. So I don't explain it to my patients that way. I just try to talk to them in like layman's terms and say, listen, the higher salt content is going to cause fluctuations in a lot of hormones in your body. It's going to send triggers to your brain to say like, okay, I need more blood pressure. I need to pump a lot harder. I need to work a lot harder. It's going to send off these like kind of like red flag kind of signals in our brain because again, our body's job is always to maintain that homeostasis. So maintain that normal blood pressure. So anytime there's fluctuations, it's going to send off a lot of these like crazy signals to our brain to be like, okay, you need to work harder. And there's these like receptors, so a lot of things can happen, but I just kind of explained it to them that like if you have the lower salt intake, that will help to improve your blood pressure. And I know it's difficult. Everybody likes the taste of salt. Like I think my husband is one of the rare people who like hates salt, like hates it.
Eh,
I don't
Hey,
know.
as a chef, that's like
Very weird, very
odd.
weird. I undersalt, like, oh, if ever I cook for him, I undersalt everything because he's so sensitive to salt. Like, he just doesn't like it. But for the most part, most people like salt. And for the most part, when we go out to eat or some of the things that we buy in the grocery stores, like, we're not really looking at that sodium content. Or when we're going out to eat, like, they're going to salt the food and cook it differently than we would at home. So I just try to educate my patients that the best thing they can do is eat whole foods that they're cooking at home, lean protein. Fruits and vegetables are not your enemy, like they are your friend. They actually can do a lot of good for our body. So I try to educate them and I say like, listen, you can season your food with other things. Garlic powder, love me some garlic. Um onion powder, whatever other seasoning you want. And I'm not saying like don't put any salt on your food at all, but a little bit, and be kind of cognizant and be aware of how much you're putting on your food.
And just that awareness level, it's kind of like how, like, when anybody decides, oh, I'm going to track my steps, they naturally add 2,000 on average just by paying attention. Same with
Right.
salt. Like, your intake will go down just by paying attention, because you'll find when you go to the grocery store, these things that you buy without thinking about it, you look at the sodium content and you have these moments of like, holy shit, why? Why is there so much in here? And then you
Yeah,
see in a product that's exactly the same 2 feet away, and it has like a fraction of the sodium. So making those like quick little changes is going to do wonders for you. And if anybody
exactly.
wants like a good rule of thumb, try and find things that are like 200 milligrams per serving or
Hmm.
less, because what that'll do is, like, usually, like, let's say you are combining foods, so you're going to get, say, a protein, something, fibrous carbohydrate like a whole grain or beans or whatever, and then a fruit or a vegetable. Okay, that protein and that carbs, like, usually the sodium is going to come from whatever the carbohydrate source is, or if it's a packaged meal, you'll see that. But when you have that all together and you have that 200 milligrams ish per serving, and you're having like one, two, maybe three servings, that gets you to like that 400 to 600 milligram range. And if you're doing that 3 times a day, that'll put you in like 1800 ish. And the RDA is 15 to 2300 milligrams. So you're right in that range. Now, you always want to edge towards the 500 or the
Right.
1500 mark, but you also don't want to go down to zero, because I've actually worked with people that have like taken it way too far, and then that could cause issues.
Right. That can cause low blood pressure, the other side.
Exactly. You want to have the right amount, not the most, not the least,
Right.
that right amount. Kind of like we
Right.
talk about with exercise. Not as much as possible or as little as possible, the right amount.
The
And
only time I'll recommend like a very, very decreased sodium intake is if I have a patient who's on 4 different blood pressure medication. I can't get their blood pressure to go down, and like I'm at my last straw as far as like what medication I can give them. That's when I'll be like, listen, you gotta cut it way down.
yeah. And all this to say, everybody listening, the best case scenario is to talk with your doctor and give them as much information as you can about all the
Hmm.
stuff we're talking about, so they can make or you can make an informed decision when they give you all the information.
Right. And
Now,
I tell my patients all the time, like, I need you to be
mhm,
honest with me. I'm never going to judge you for how much salt you put on your food. I'm never going to judge you for what you do. Like, that's not my job. My job is to help you feel better. So if you're just honest with me, you tell me exactly what you're doing, then we can kind of have a conversation and work together and be like, listen, okay, I see what you're doing. And sometimes I'll recommend patients even keep a food diary and bring it in so that I can really see what's going on.
yeah. Yeah. And with all of that, I can tell you, like, if anybody listening is like, oh, fine, I've been there. I didn't tell my doctor I smoked weed for the longest time. And then go figure, that could actually play a role in anxiety. So here we are. So always, always be honest with the doc. They're there to help. Um, and then the other thing I had for diet was also how you mentioned, like, when it comes to like CAD, like, saturated fat content is huge when it
Hmm.
comes to cardiovascular health. And unfortunately, right now, we're seeing these pushes in the fitness and the wellness space for like carnivore, or like substituting beef tallow instead of seed oils. And it's driving the the amount of saturated fat in these people's diets up if they're not careful about it. So, what can happen when saturated fat levels go up, and then it affects things like your LDL and VLDL and things like
Hmm.
that?
So LDL is one of the biggest things that I look at when I do a cholesterol panel on a patient. Not so much the total cholesterol, but I look at like the LDL, because a lot of our goals, as far as like say a patient's had a heart attack or a stroke, our LDL goal is for it to be less than 55 if they've had a cabbage, like a heart um, coronary artery bypass graft, sorry. And even like less than 100 in most patients I need, depending on like what their risk factors are. So anytime you have an increase in the saturated fat and you have an increase in LDL, your chances of having blockages in your arteries goes up like exponentially. So it's something that is a big concern, and especially in the patients that have high blood pressure and they're already at a high risk for stroke and heart attack. And there's a guideline, it's called the ASCVD risk that we use for our patients as well. And we use that calculator to determine what their 10-year risk is of having like a heart attack or a stroke based on their cholesterol levels. So those are all driving factors. And the higher your risk, obviously, the higher like your chances of having a heart attack or a stroke in the next like 10 years.
Yeah. And with that calculator that you use, how accurate would you say that is? Like, have they like studied like about how spot on that is?
It's been like widely studied, and because it's something that we use a lot. And it's basically it's how we determine the amount of, like, say a patient needs like a cholesterol lowering medication. That's what I use to determine, okay, do they need like a moderate intensity statin or a high intensity statin or that sort of thing. So like if your ASCVD risk is between like 7.5 and 10, you're on that borderline, but like you do need to start a statin based on your risk factors. If it's anything above that, you're most likely going to need a moderate or a high intensity statin. This is our like primary or secondary prevention of heart attack or a stroke, we call it.
And the reason I bring that up is because, unfortunately, like, again, I keep referencing the fitness and the wellness space because, unfortunately, there's a lot of misinformation going around. And one of the things that a lot of these grifters or people that just are not informed enough or educated enough on the topic, they always go for mechanisms rather than outcomes. So that's the reason I was asking, because, like, at the end of the day, if we say, okay, this plays a role and we use these calculations and it's been shown that, hey, people die earlier when this is an elevated thing, you can play all the mental gymnastics you want and cite every mechanism in the body, but at the end of the day, people are still dying early who have this elevated risk factor.
Yeah, of course. It's 100%. There's patients, unfortunately, I've seen more patients in the younger 50s, 60 years old drop dead of heart attack and stroke and have ridiculously high cholesterol levels than what it used to be. Like it used to be that you wouldn't have a heart attack until your 70s or 80s, but I've been seeing it a lot younger, and I've even seen wildly high cholesterol levels in young patients, like 20, 30 years old, like our age.
Yeah. And I know that the go-to argument here is like, well, they're putting all these chemicals in our food. But let's be honest, back then people worked more manual labor jobs. DoorDash did not exist. McDonald's and Starbucks was not on every corner. Every job that you work does not have 24/7 access to you, stressing you out all the time. And your
Exactly.
kids did not have a million things on their calendar. They would just leave and then come back when it got dark.
Right. Yeah, I can't let my kids outside by themselves. Like that's not a thing anymore.
Yeah, exactly. It's just times have changed, but it's like we got to attack the right boogeyman. And it's
Mhm.
these lifestyle factors, really, at the end
Right.
of the day, are these big rocks. And the last one I had on my list was smoking. Now, I mean, I feel like there's going to be somebody listening, like, you're taking every joy in my life away from me. But when it comes to smoking, how does that impact blood pressure?
So again, it causes damage to your blood vessels anytime you smoke. Smoking has been wildly studied, and it's not just affecting your blood pressure, it affects your lungs, causes COPD, lung damage, can cause lung cancer, can cause oral cancer. Like there are so many bad things that can come from long-term smoking. There's also it can cause aneurysms in your aorta, in your like it's very, very bad. And it's one of the things that I wish we can ban so many things in this world, but we can't ban smoking or cigarettes, unfortunately. And it's something that I've seen more often than not causing so many complications in patients that could have been easily avoided.
Yeah. Because I mean, if we're being honest, like if we just had a total ban on tobacco, for example, everybody would be miserable for like a month or two. But then after that, it'd be like, all right, like, yeah, I miss the act of doing it and pairing it with my morning coffee and whatever. But it's like it's through you're past that point. Like you're not on the same level of deprivation.
Right. And the
And
long-term damage is unfortunate. I've seen it happen way more times than I would like to admit, especially in the inpatient setting, watching patients with COPD and they're on oxygen lifelong, or having lung cancer that has gone to every part of their body and they've lost their battle. And it's very unfortunate because it could have been avoided.
Absolutely. And when we talk about smoking, it's also not just limited to tobacco use, because I think a lot of
Hmm.
people are under this guise that, oh, if I smoke weed or if I vape, it's not the same. It's not as big of a deal, which you can make a case because there's no tar in it. But at the same time, it's not risk free.
Right, right. There hasn't been as many studies on marijuana use as there has been on tobacco, but there's been a lot of studies on vaping as well, any sort of tobacco, but um, there hasn't been as much studies on other things, but anything that you're inhaling can potentially
Yeah.
cause some damage.
Because at the end of the day, if we are taking in heated vapors, it's going to negatively impact the
Hmm.
lungs. Is
Hmm.
would you say that's about accurate?
100%. Yeah, 100%.
Okay.
It
Yeah.
just
Because
hasn't
I
been
know.
it just hasn't been studied with that, like the marijuana, like weed aspect. That hasn't been studied because I just think like nobody wants to pay for that study. Like it should be studied. It should be something that's like studied, but can't get the funding for it, unfortunately. But vaping, there has been a lot of like recent things coming out about the dangers of vaping.
Pretty much anything big tobacco supports, you could just assume the opposite. Like whatever
Hmm.
they think is good for you, just assume the opposite. And if anybody wants a fun Google search, like they're like, come on, it can't be that bad. Just Google popcorn lung and just see how you feel about that.
Hmm.
Um, yeah. So, anywho, now let's talk about what to do. So, we just talked about the diet, like obviously keeping control of our sodium, making sure our saturated fat. By the way, I meant to tell everybody saturated fat, the guideline is 10% or less of your total calories per day. So, if you know how many calories you're taking in, like we'll assume, say, 2,000 calories, that means 200 calories from that should be from saturated fat or less. So you just divide that by 9, which gives us about just under 20 grams. And that's how much saturated fat you should have throughout the day at the max. But if we can drop it really, really low, even better.
Yeah, absolutely. Anything when it comes to saturated fats, anything like
Yeah.
lower is better.
And this is why, like, the whole seed oil thing is so ridiculous, because anybody who takes a break, just takes a brief break from their echo chamber that they're listening to all these people saying the same thing, just take a pause and look at the actual study. And it's the actual opposite of what they're
Hmm.
saying. You're just like, I
Hmm.
don't understand why these people are trying so hard to like
Hmm.
spit lies at this point.
It's like the bane of my existence, like going on TikTok sometimes and just seeing these things. And then, obviously, as a like new-ish mother, my son is going to be 1. He's on formula, and seeing even that stuff when they're talking about seed
God.
oils and formula, and I was like losing my mind. But that's a
I
whole
I saw
nother
something.
conversation.
I saw a video of a woman trying to justify giving your baby water, and I'm just like, oh my god, we really need to like
Like,
put a pause on who can
yeah.
actually give out information and who can't.
Hmm. It's exactly. It's very, very frustrating, and there's been multiple times I've just blocked people. I'm like, I can't listen to this.
Yeah,
Like,
that should be like a one strike policy. You give something that could potentially kill somebody, you're out.
yeah, yeah. I was like, the next podcast we talk about cortisol, because that is like the bane of my existence recently is cortisol.
Ooh, we're gonna
Yeah.
have to do another cortisol one then.
Like,
I mean, if we have time, I mean, we still have time. Like we could do cortisol. This will be a dual, a dual episode. But let's talk about exercise, because this is one of those things that honestly, like as a doctor, would you agree that like it's probably one of the first things you talk about? It's like, well, why don't
yeah.
we try and introduce exercise?
Hmm.
That'll probably do a lot of good.
Exactly. It's exercise does a lot of good, not just for our body, but for our mind. And it's something that I constantly recommend to my patients. Like getting outside, doing at least like, I recommend at least like 100 minutes, quote unquote, of something a week, whether it's walking, doing some sort of weightlifting, something that's going to get your heart pumping a little bit. Like we're starting to get a little warmer here, so it's a little bit easier to kind of convince patients to kind of go out and go for a walk in the winter. Tends to be a struggle because nobody wants to go outside or do anything. But exercise does so much good for our bodies and our mind, and it's something that I do constantly recommend to patients.
And let's be honest, when you look around at people that are 80, 90, maybe they're in the hundreds, what are they all doing? They're going on their daily walks. Like, they're always moving. So if you want to be in the cool kids club and put yourself in a good situation, walk. But
Exactly.
to bring it back, I actually took a look at what the guidelines are for AHA, and it's 150 minutes for aerobic exercise. So for anybody who is like aerobic, what the hell is that? It's basically the exercises that require you to use oxygen while you're doing it. So anaerobic would be not using oxygen, kind of like holding your breath and like pushing like heavy weights style would be
Hmm.
anaerobic, and then aerobic would be like cardio.
Right.
All right. So
Yeah,
a
150
hundred,
is the goal, but I say
yeah.
100 because I'm like,
Oh, yeah,
set expectations. But 150 is
exactly.
definitely, if I could get them there, that's even better. But yeah.
And you're speaking the language of this podcast because we talk about it all the time. There are the guidelines, which are great. Like, let's get
Hmm.
there. But at the end of the day, you got to meet yourself where you're at. Like, if you are getting zero and you're like, I'm going to do 150, that'll probably
Yeah,
last for
it's
like a week. And then you're
exactly.
going to be like, screw this.
Yeah, I have to always like think about my patient and what they've been doing. And if they haven't been doing like anything, I know that I'm not going to get them to do 150 minutes. Like that's just unrealistic and that's not my goal. Like just incorporating something, like I tell all of my patients, no matter what we're talking about, whatever's going on with their body, this is a conversation. I tell you what the recommendations are, the guidelines, like and we have a conversation. If you tell me like that's just not something that's going to work for me, all right, well, let's figure out something that will. Let's try to get you to where you need to be, but like slowly. I want patients to make changes that are going to be lifelong changes and not like, okay, I'll do it for like a week and then like, nah, I'm good, I'm done.
Exactly. Exactly. So, along with that, they also recommend 2 days of strength training. So, if you can do that, awesome. And you could pair it all together. Like, for anybody wondering, how the heck would I put this together for like a normal week? Like, you could do 10 to 20 minutes of walking 7 days a week and then do 2 strength training sessions, and you nailed it. So when it comes to the strength training, I have clients right now that do as little as 20 minutes. So if you have a daily habit of say, I'm going to give myself 20 minutes to do some sort of exercise, you're going to hit those guidelines. So when it comes to the 20-minute walks, just do a 20-minute walk. And if it's cold outside, go to the mall if there's a mall near you, or invest in a walking pad. They're like $100 or less now. There's some solid ones on Amazon. You could get one of those. You could walk up and down your stairs, and like while you're cooking food, like put something in the oven, set the timer for 20 minutes and start walking the stairs. And you will feel amazing a couple of weeks down the road compared to where you started. And then when it comes to the circuit or the 20 minutes, do a circuit style workout. Pick 4 things: something pushing, something pulling, something for your legs, something for your abs, and just go and do like 10 repetitions of each and see how many rounds you can get. If you can increase weight over time, if you're able to do more rounds over time, if you're able to do more reps over time, that will send a message to your body: build me some more muscle, build me some more thicker bone density, and improve my cardiorespiratory health, because doing round after round after round will get your heart pumping. So
Hmm.
it doesn't need to be complicated. It doesn't need to be these long, crazy workouts you see on Instagram and YouTube and stuff. It could be 20 minutes a day.
Right. Yeah, absolutely. There's been a lot of studies, even like just doing 10,000 steps a day is great for your cardiovascular health and things like that.
Yeah, I remember it when I was presenting to you guys when you during the residency, when I was trying to bring my receipts, because I'm like, I'm talking in front of a bunch of doctors. I better come with some receipts here. I looked at one study that was like, from when you go from like zero, so basically like bed bound, to 2,000 steps, the decrease for overall mortality risk was
Hmm.
like an avalanche, like a
Yeah, like a
sharp
plummet. Yeah.
decline. I was like,
Yep.
holy crap. Like, if you just get walking a little bit, major improvements.
Yeah, absolutely. Yeah, it's crazy, but it's true.
Yep. Yep. So, if anything, if you guys are listening to this and you're not doing anything at all, if you can commit to a 20-minute walk a day, you will put yourself in a very good situation.
Yeah, absolutely. Yeah, I 100% agree. Like I even like I try myself to take the stairs. Like we're on the third floor, so it's not that many stairs, but I try to take the stairs instead of the elevator. Or like when it starts to get like nicer out on my lunch break, go and just take like a lap around the building just to get out a little bit.
Yeah.
Like
And that's
nobody's
got benefits
perfect and
too.
I'm not perfect either, so
Yeah.
I try my
And that's
best.
that's got even more benefits getting outside. So if anybody listening right now is like, "Oh,
Mhm.
I could actually like it's starting to get warm out," just getting out in the sun can help things like your circadian rhythm. So you might find that it's easier to fall asleep later at night. So there's a lot of benefits to just getting out and doing the thing.
Absolutely. Yeah.
Yeah. And now that my mind's going, spinal hygiene is another big one too, because if you're sitting at a desk all day, your hips are flexed, and all of a sudden you're walking and you're stretching out and your hips are extending, it could take pressure off your lower back, off your upper back, your neck. Like it can feel really good when you get to walking consistently.
Mhm. Yeah. No, I definitely need, as I sit in my desk all day and like I like cross my legs. I sit in like the worst. It's like the worst. I sit in the worst position probably for my
Yeah.
back, and
That's
um
one of my favorite questions. Like when
yeah.
somebody comes to work with me and they've got like low back pain or stiffness, I'm like, so tell me, how do you sit? And they're like, well, I'm basically like this for 8 hours a
Sit like
day.
this all day or like this or whatever it is. Like, yep. And a lot of like, even in the office, like when I see patients, the chairs don't have backs to them. Like they're just little like spinny, like rolly chairs.
Yep. Yep. It's
Not the
never
best either,
the
but
perfectly ergonomic, like, oh, this is
yeah.
great for you. It's, well, the office had X amount of dollars to spend and this is what we got.
Yeah.
But simple stuff, guys, simple stuff. If anybody
Exactly.
is suffering with like low back pain, stiffness, it could be worth looking into like how you sit and just not even like saying, oh, I got to get a standing desk and go this route. It's more so just keep switching positions because there's no such thing as perfect posture, but perfect posture can be classified as being able to be in any position without pain. So
Definitely.
on that topic, I'm thinking we shift gears because I want to go down that cortisol rabbit hole because
No.
if we're gonna go in, I want to make sure we go in and we still got a little bit of time. So I know that at least on my end, I see a lot of people like sharing videos and stuff about cortisol face and like basically saying that cortisol is the reason that you can't lose weight. Cortisol is the reason that you feel like shit. Cortisol is the reason for world hunger. Like, what is up with cortisol and what do people actually need to be concerned
Yeah.
with?
Cortisol is something that your body naturally produces. Everybody produces cortisol. Cortisol, there are syndromes of excess cortisol, but they are very rare. And you would have to have certain symptoms for me to be like, oh, you have, and hypertension is actually part of that. So if you do have high blood pressure, you want to look for like central obesity, and they'll have this what's called like purple striae, which is like
When
just
you
like the
say
stretch marks in
central
purple.
obesity, are we talking like apple shape? Like,
Yeah, yeah, like that, just abdomen kind of
yeah,
central.
like the trunk
Yes,
more so than the
that
legs.
yes, yes.
Yeah.
And that's going to trigger me to more think about something called Cushing syndrome, which is like that high cortisol. But cortisol is something that our bodies just naturally produce, and we have means and mechanisms to maintain that homeostasis where if for some reason our cortisol may go up tiny tiny bit, our body regulates it and it's like, okay, no, you're good, calm down. So like there's nothing that has to do with like cortisol face, like unless you have Cushing syndrome, which again is
In
rare.
in which case, go to your doctor, stop listening to
Right,
TikTok advice and drinking
right,
these random herbal teas that don't do
right,
diddly squat,
right, right. Like, please.
or
I've
buying these
had,
ridiculously expensive supplements that are not shown to help in any way other than trust me on this. This person says it works. This person says it works, even though you might not have ever met them or they might not even be using their product. They could be ripping off a review from a different product and you'd never know.
right. And cannot tell you how many patients I've had in the last couple weeks come for a visit with me and be like, can you check my cortisol? And I've like taken a deep breath and been like, listen, I understand that there's a lot of things that you're hearing out there, but me checking your cortisol, unless you're having certain symptoms, is not going to change anything. And the way that we check cortisol, it has to be like first thing in the morning. It's an AM cortisol level. And 9 times out of 10, probably 9.8 times out of 10, it is your cortisol levels are completely normal. And
And that
teas
actually,
and supplements are like, I can't.
yeah. That actually made me think of another thing that I'm seeing a lot of these days, which is people that don't necessarily have access to good health care being recommended to do these like labs that are afford or
Unnecessary.
that they
Yes,
buy online that are $500 and they do a full metabolic panel, but then they basically put you on the phone with a provider that's probably like a nurse practitioner or a physician's assistant, and then they go through your blood work with you as if you're getting this like extra special treatment. But
it's not
if they're supposedly doing hundreds and hundreds of tests on you, like what are the benefits and then what are the downsides of that?
right. There's there's no, unless there's a medical indication or like symptoms, there's no reason to run some crazy panel checking all of these things. And a lot of the times those panels that cost like $500-600 are checking things that like have no data behind them, like not been studied, sorry, have no indication for them. Like it just it's a way to take money from people, and it's upsetting because it's not necessary. And sometimes you'll test things and like you're getting answers that you don't necessarily need, or there's no treatment for or anything like that. Like there I think I saw it on TikTok. There was some guy like promoting his like blood panel, and it was like $600, and he was checking like hormone levels, which for like a female, like your FSH, LH, those sort of things. And unless you're checking them at certain periods of time, it's not going to tell you anything. Like women's hormones fluctuate based on their cycle. So you checking those is not going to do anything. It's not going to change management. It's not giving us any information that's going to help us guide treatment going forward.
And it's interesting you say that because that's what a lot of people don't seem to understand is like, yeah, it's cool information to have, but what do we do with it? Like I remember talking with like one of the guys who is the literally one of three people in the world that have the label of chiropractor that I would trust, because many you cannot, but he's one of the good ones. And he's like, so many people ask, like, should I bring in my MRI? Should I like go get an MRI? And he's like, you can, but it's really not going to change what we do. So save yourself some money, because at the end of the day, all it's going to do is make you hyper aware of this thing, where that might actually be worse because you're thinking, oh, this thing, instead of, okay, let's focus on the things that are going to get you better.
Right. And that's 100% what I teach our residents that I work with. If it's not going to change your management, why are we ordering it? Because this may cost the patient money out of pocket that they don't need, and it's not going to change how we treat them in the long run or their prognosis in the long run. So, is it going, that's like one of my big questions I always say, is it going to change our management by ordering all these tests? Or is it only going to cause a financial burden or a stress on our patient that's not necessary?
Yeah. And now that we opened up this can of worms, I got questions because I
Oh,
mean,
geez. I shouldn't
in the
have said
fitness
anything.
space, in the fitness space, there are so many people that are so hyper vigilant of their health. They're like, I want to do everything possible to be in the best position possible so I could be the pinnacle of health. And these are the people that usually buy these tests to like get to that level where they're like, okay, I'm doing everything, I'm checking every box, which is admirable. It's like,
Right.
okay, you want to be the most healthy you can be. Never going to say that's a bad thing, but the big things that come up that people are super concerned about are like number one, test levels. So like if somebody is concerned about their testosterone, first off, what is a actual healthy range, and what is the way to know, hey, I should probably get tested for this?
Mhm. So when for me, I just look at the lab work, and they usually tell me like on the every lab is different, but I think it's like 300, 3 to 400 is like the max, as far as like if it's anything below that, then I'm usually like okay, and they're symptomatic. Like I have patients who have like a 200 and they're like symptomatic type of thing.
Yeah,
And I
because
talk to the patient
isn't
about
the
their
range
symptom.
like somewhere from like 2 or 3 to like 1,000?
Yeah.
Like is where most
Yeah.
people most people's free
Most
test
people
sits.
live, yeah, most people
Yeah,
live, yeah. So, like, anything I think, like, on our labs, it's, like, anything below 300 is where it kinda, like, flags it, saying, like, "This is low and, like, should be addressed." But, and I think that's another one of those, like, misconceptions. Like, I've had patients who were taking testosterone from the street, and their testosterone level was 5,000, which can cause heart attacks and strokes and high blood pressure, and your face will be beet red and can cause multitude of other complications, could cause damage to your liver, all of these things. So,
Yeah. And when it comes to that, like going that high level, I know naturally when somebody sees the range, okay, 300 to 1,000, I want to be 1,000 because I want to be at the upper end of the range. Is there any benefit from being like at the bottom to the top to the middle? Like, is there any added benefit to that?
no, no, not at all. It's just more like how you're feeling. Like if a patient tells me that they're feeling like low libido and their testosterone is kind of borderline, then I'll have a conversation with them and say like, okay, maybe you would benefit from like a low dose or something like that. But um as far as like symptom wise, like I've had patients that are even on the higher end and they still say like, oh, I don't feel great. Or they were on the higher end, like my patient that was 5,000, we stopped the testosterone and then they started to feel terrible, probably because their body was so used to being like at that kind of high level. But it's again one of these like conversations I have with patients, and it's a lot of the that goes along with a lot of lab values. Like some patients can tolerate also a really high blood pressure and not feel anything at all, and some patients cannot tolerate it because they feel symptoms.
Gotcha. Yeah, because I think at least in my area, people think, oh, more testosterone means a greater ability to put on lean body mass. So, is there any benefit at all from like 300 to 1,000, or it's like we have to get to those extra high levels to see any pronounced benefit?
Can't say that I know the answer to that, to be 100% honest with you. I really don't
Well,
know.
now I got something to look up
Yeah.
after this.
Yeah, I was like, I would maybe look like I really don't know. I'm not 100% sure on that. I just know the complications of long-term like testosterone use at an elevated level, but I'm not exactly sure as far as like building like lean body mass and things like that. And I don't want to give you like the wrong answer.
Hey, again, people, green flags, doesn't know the answer and totally owns up to it. Doesn't try and act like an expert on everything like you see on pretty much every other podcast. All right. So we covered tests. Now, the other big one I hear a lot about is thyroid. So when it comes to thyroid function, especially like people that may be dealing with like say PCOS or something,
Mhm.
or like they just genuinely have like hyper or hypothyroid issues, like what are some things that you look for, or what are some symptoms that you look out for to be like, okay, we should probably test this?
So when we're talking about like hypothyroidism, so like your thyroid is on like the lower side. So the patients will feel like fatigued. They'll usually feel like very cold, like, but not cold in a sense of like, oh, it's cold outside. Like they'll be in a room of a bunch of people and they're like, I'm freezing and everybody else is comfortable. That sort of thing. They will have trouble losing weight, anything that kind of like, and if you think of like the slower, like everything's kind of slowed down. If we're talking about hyperthyroidism, it's the opposite. So like palpitations, they'll be like constantly hot and sweaty, increased anxiety. They most likely will have no problem losing weight and they'll eat all the food in the world and be like a stick, like very, very thin.
We
So
hate these people.
right, I wish. They may also have an enlarged thyroid. So like when I do a physical exam, I may feel that their thyroid is like bigger. And that's when I kind of go, okay, let's check your thyroid levels, and that includes like what's called a TSH and then a T4 level.
Gotcha. Gotcha. That's very good information to know because I know a lot of people will, when they're trying to lose weight, for example, they're like, is it my hormones? Is it my thyroid? And it's like,
Mhm.
well, we haven't really tracked your calories at any point for a month consistently. And we also have no idea what is a lean protein and what's not because you're still eating peanut butter thinking it's good for you and it's got a bunch of protein in it when it doesn't and it's driving those calories up. But they're like, no, it's got to be my thyroid.
Yeah, so the thyroid is something that I regularly check if a patient's coming in for like weight loss and like they're having trouble not weight loss, but they're having trouble losing weight. So it's one of like the panel of blood work that I will like include in my order set just to kind of rule it out. I always tell patients like let's rule out the medical causes or medical reasons. Oh, my jersey
Mhm.
came at causes. Sorry.
The
The
causes.
causes. Geez,
All
my
right,
jersey.
let's talk about the next thing.
Yeah.
No,
Like,
I'm kidding.
geez. So yeah, that's one of the things that I do order. But again, like 9 times out of 10, it ends up being normal. But I do have some patients that they'll end up having some fluctuations in their thyroid levels.
Gotcha. That's all very good information to know. And honestly, that's like the best starting point for anybody who's considering jumping on a diet, jumping on an exercise program is just check with your doctor to rule out all this stuff.
Hmm.
Because if they don't see any red flags and you're like, okay, I've got a clean slate, this should work really well, assuming I follow the plan correctly, then that's the best way to go about it.
Right. Right. Absolutely. Like I always recommend go to see your primary care doctor, get a full panel first, make sure everything is like checkbox in order, and then speak to somebody like you who can counsel them on proper diet, what's a lean protein, make sure that they're getting their amount of calories they need throughout the day and things like that. So it's always good in combination, but I always think that everybody should have a primary care doctor and everybody should have kind of like a baseline to know where they're at.
Yeah. And when you
Not like
say
I'm
to get a
biased at
pan,
all being a primary care doctor.
no, I mean, and at the same time, not expecting your primary care doctor to know every single thing. That, like,
Right.
honestly, a lot of times they're a great triage where it's like, okay, I can check X, Y, and Z, but if we need to take it to the next level, you got to go see a cardiologist or an endocrinologist or a gastroenterologist, somebody who is like that next level. But at the starting point, you are the best resource in the world.
Right, and I think that's like the goal of primary care, and that's always my goal, is I try my best to treat the patient as much as I can to my level of expertise and my level of comfortability. If it does get to a point where it's like, okay, yeah, this is like definitely above my pay grade and I need to send them to a specialist, I have no problem referring patients out to a specialist, but I try my best to treat as much as I can in-house so that patients don't have to go to multiple doctors. But there's so many options for like doctors out there as far as specialists go. So it's very easy to refer. But sometimes they can't get appointments with them. So it tends to be sometimes a little bit tricky when it comes to referring out, but I do the best I can to try to manage as much as I can in-house and then kind of go from there.
Yeah, and I think that's another good topic, which is the fact that a lot of times when people have complaints about their doctor or the whole thing, it's usually a logistical issue more times than not because
Hmm.
the way the system is set up, you barely get any time with anybody and you're just like rapid fire in a lot of situations, which sucks, like for everybody involved. But it doesn't mean that you can't do your job with the information that you get. It just means that like you're not going to be able to sit down with somebody for an hour like a quote unquote functional medicine doctor that might not even have the right to call themselves a doctor, but they get a better experience because they get to sit down and be heard, even
Hmm.
though you're giving that highest level of actual help.
Yeah, I try my best to give my patients as much time as I can. Um, we're at the mercy, obviously, sometimes but I try my best to listen to my patients and give them as much time as they need. And like you said, you're absolutely right. When they go to a specialist, they're a lot busier than I am as a primary care doctor. Like they usually have to see double the amount of patients that I have to see throughout the day. And their wait list is usually 3 months while I can see a patient within usually the month, depending on my schedule. So like I said, I try my best to keep everything like in house and treat as much as I can as a primary care doctor, so that they don't have to struggle to find a specialist or get in with somebody else.
Yeah. Yeah. And now let's say, like, I know a big complaint that I've heard from my own clients. I know I've heard from other coaches is like, God, my doctor sucks. They don't listen to me. They don't do this. But you just mentioned like a panel, like getting a full panel. And like, just to make sure that people are actually staying up to the guidelines and they're getting the best possible care. They don't have one of these old guard people that are like, almost borderline retired and they're like, I don't need to look at that. I've been doing this for 40, 50 years. Like, what is an actual full panel? Like, what are some things that they should look for that they're being
Mhm.
tested for? Like, what is the
Yes.
standard?
Yeah. So there are some standards as far as screening goes, and that comes from the US Preventative Task Force. And there are some standards as far as checking your cholesterol and hemoglobin A1C for diabetes. But if I have a patient come to me, they're just here for their yearly exam. They may have some complaints, may not. It's kind of a conversation where I say to them, like, listen, do you want to have a full panel? Or do you just want to check the things that I think are relevant based on your complaints today or based on what your chronic medical conditions are? So if they say they want the full panel, then that usually consists of a CBC, which checks your blood levels, your hemoglobin level, which is your red blood cells, checks your platelets, a chemistry or CMP, which checks your liver and your kidney function, your electrolytes. Then we will check a hemoglobin A1C, which is that like 3-month average of your blood sugar readings. And that's how we can diagnose diabetes. And then a lipid panel, which is your cholesterol. And then sometimes I'll throw in a TSH, a thyroid level as well. And sometimes I'll throw in a urinalysis depending on the patient just to see if there's anything. And that's kind of, I guess you would consider like a basic workup that I would do for just like a healthy person, really no other complaints if they want just like a full blood panel.
Gotcha. So everybody write that down just in case you're concerned, because I know that is one of those big things going around. They're like, oh, doctors aren't looking at all of the things that they should be looking at, where
Mm-hmm.
it's like, do you want to pay out the ass for things that are not indicated? Then by
Right,
all means. The only thing
right.
that I would really like have a question on based on my own personal experience is like getting a calcium score, because that literally saved my dad's life. And I've heard of many stories like that where there's really no symptoms going on, but then you go for a
Uh,
calcium score and anything over 0 is no bueno. But it's like his was like, I think 1,000 or something like
mhm.
that.
So yeah, so calcium scores, I recommend them. So say I have a patient who gets a cholesterol panel, they get their lipid panel, and their cholesterol is elevated. I do their ASCVD risk, and it's recommended for them to be on a cholesterol lowering medication. I have a conversation with them, and they're like, I don't know, I really don't like medication. I'm not really a fan. I'm worried about side effects. So I say, okay, that's fine. I say, listen, there's something else called a CT calcium score. You can go have it done. Some insurances pay for it, some do not. I believe like the out-of-pocket cost sometimes is like less than $100. You just kind of
Yeah.
shop around. I tell
It was like
patients like,
90 to 100 when they
yeah,
got quoted. Yeah.
yeah, like you can shop around for it. But I tell patients, I said, hey, get a calcium score. If we see any blockages, then that'll tell you like you really do need to be on a statin. You're high risk for heart attack, stroke, these sort of things. And we should really be on a statin. So there's no current guidelines to recommend like routinely doing a CT calcium score, but that's what I've seen from some of the cardiologists that work in our area. And it tends to be really good for patients because once they see that high calcium score, then they understand that I'm not just trying to push a medication. I really just want to help lower your risk of heart attack and stroke in the long run.
Which brings me to my final question, because I think this will be a great way to cap it off. For those who are like, oh, doctors are paid off to dish out medications, how much money have you made? Be honest. From
From
medication dispersing,
medications,
for being a legal drug dealer, what are you given?
zero, $0,
Lies,
$0.
lies.
I make no money off of prescribing medication. I am a employee of the Rutgers, the RWJ Barnabas system. I get paid from them. I do not make any money from pharmaceutical companies. I don't get any kickback. Like, would be nice,
Well,
but I don't make any money off
we
of that.
we can't
I
say
do
you
get
don't
the
get
nice lunch
anything.
I
You
know, we
get
do
a
get
nice
lunches.
Panera lunch.
We do. We do get some nice
You
Panera
get
lunches. I
bribed
will
with
not lie.
Panera.
I do. I do get bribed with food every once in a while. I'm not going to lie about that one. But as far as monetary things, I do not make any money. I actually like, I will say to close it off, like I thoroughly enjoy arguing with the insurance companies to get things covered. And I love advocating for my patients. So if they get like a denial for a medication and I really think they need it, I thoroughly enjoy doing those peer-to-peer phone calls. It's just so much fun to me because it's it's funny that they can deny it when it really is like medically necessary. So I just thoroughly enjoy it.
Yeah, yeah. Get a doctor who's willing to go to bat for you. And I could tell you
Yeah.
right now, as a son of a former pharmaceutical rep, if you still believe that your doctor is making crap loads of money pushing medications, you're outdated. Like that is no longer a thing. It's actually illegal now.
Yep. It's
So you
illegal. Yep.
cannot do it. All
Yep.
right. So
It's
if
very
anybody is,
illegal.
and if you hear anybody pushing that rhetoric, just know they have no idea what they're talking about and they got to get with the times.
Yeah. Yeah, exactly.
Yeah.
I swear I make no money off of it. I just The
Would be
lunch every
nice
once
though.
in a while is nice, right? Like, it's
Would be
okay.
nice. I mean, if my fiance got money from like pushing stuff that she normally gives, I'd be like, "All right, babe." But nope,
Yeah, right.
we're just not we're not rolling in the dough. Sorry,
No,
sorry, folks.
no, sadly not. I make an honest living, but I love what I do.
But go keep supporting your people pushing cortisol supplements and all these things that they get a direct kickback from, which is why the wellness industry is now 3 times the size of the pharmaceutical industry. Just saying.
Yeah, exactly. Exactly. All those influencers, but
Yep. But this has
I
been an
digress.
incredible talk. Like, I don't want to keep you anymore because I know you are working today, which is why
I
people
am, yeah.
I try to get real doctors on here because most are too busy doing their damn job to be on social media. So thank you, Gabby, for being one of the real ones and actually giving us quality evidence-based information instead of being all the grifters that are unfortunately habitating the space online.
I appreciate it. Thanks for having me. It's always fun, and I enjoy our conversations.
Hey, same here, same here. I can't wait to get you back for another. I don't even know what it'll be on, but I might just get you on and be like, "So what do you want to talk about today?" All
I
right,
like
so
that. I like that. If every time I
yeah.
hear somebody say that, I was like, I'm a wrestling fan. If you watch Cody Rhodes and he always comes on the mic, he's like, "What do you want to talk about?" So next time.
There we go. There we go. Now, everybody listening, as a big thank you to Dr. Gerbino for being here. If at any point you heard something during this podcast where you're like, oh my God, my family member needs to hear this, and based on the fact that almost 1 in 2 people have high blood pressure, share it with 2 people. Chances are one of them needs it. So go ahead, send it their way. Tell them we said thank you. And also be sure to subscribe or follow so you don't miss that next episode with Dr. Gerbino as well. So thank you guys for tuning in all the way through. Until next time, go kick some ass. See you later.